à l'Omicron sur notre système de soins de santé. Rien qu'au cours des derniers jours, nous avons constaté une augmentation importante des hospitalisations et des admissions aux soins intensifs. Hier, il y avait 2081 personnes hospitalisées, dont 288 en soins intensifs. Aujourd'hui, ces chiffres sont de 2279 et 319. Les mesures que nous avons mises en place devraient contribuer à diminuer la pression et gagner le précieux temps dont nous avons besoin pour accélérer le déploiement des doses de rappel. Je continue de demander à tous les Ontariens et à toutes les Ontariennes admissibles à une dose de rappel de l'obtenir le plus tôt possible, et cela comprend les personnes enceintes. Les données récentes montrent que les pays qui ont une bonne couverture en matière de doses de rappel s'en sortiront mieux contre le variant Omicron. D'après les données provenant du Royaume-Uni, le risque d'être admis à l'hôpital avant l'Omicron, ou pour l'Omicron plutôt, est de 81% plus faible chez les personnes qui ont reçu 3 doses du vaccin. Quelles que soient vos première et deuxième doses, une troisième dose de tout vaccin à messager ARN augmentera votre protection contre le virus. Les dernières données montrent que la protection offerte par le vaccin Moderna, en particulier pour les personnes âgées, est plus forte. J'ai moi-même reçu le vaccin Moderna comme dose de rappel. Son immunité est très forte et prolongée. Même pour les personnes déjà infectées au coronavirus, le vaccin fournit une protection supplémentaire et peut être administré dès que la période d'isolement est terminée et que tous vos symptômes sont disparus. Je souhaite remercier tous nos vaccinateurs. Hier, vous avez administré 182 938 doses. Nous avons constaté une augmentation considérable de l'apport de soutien en raison de notre appel aux armes, mais nous éprouvons des problèmes d'absentéisme et donc nous avons besoin de renforts. Si vous êtes en mesure de vous porter volontaire pour nos efforts de vaccination, veuillez vous inscrire dès aujourd'hui sur le portail ontarien des bénévoles pour l'intervention contre la COVID-19 et le portail ontarien pour le jumelage des effectifs de la santé. Je souhaite remercier les 48,8% des enfants âgés de 5 à 11 ans qui ont déjà reçu leur première dose du vaccin contre la COVID-19. Et j'encourage tous les parents et les enfants qui n'ont pas encore reçu le vaccin à prendre rendez-vous le plus rapidement possible. Dans le cadre de nos préparatifs pour reprendre l'enseignement en personne le 17 janvier prochain, l'augmentation du taux de vaccination chez nos élèves contribuera à la sûreté de notre environnement scolaire. Nous offrons également un meilleur accès aux vaccins de rappel contre la COVID-19 au personnel enseignant et aux travailleurs des services de garde. Au cours de cette période précédant le 17 janvier, nous nous efforçons de faire en sorte que nos écoles restent des lieux d'apprentissage sûrs. Cela comprend l'accès à des masques N95 facultatifs non ajustés pour le personnel et l'amélioration continue de la ventilation dans les écoles, notamment grâce au déploiement de filtres EPA supplémentaires. Enfin, bien que nous donnions la priorité d'accès aux tests antigéniques rapides aux milieux à risque élevé, nous nous efforçons de distribuer ces tests pour qu'ils soient utilisés efficacement afin de favoriser la réouverture des écoles. En ce qui concerne les tests, n'oubliez pas que l'Ontario a mis à jour ses lignes directrices en matière de tests afin de protéger les personnes les plus vulnérables et de maintenir la stabilité de la main-d'œuvre essentielle, notamment les travailleurs de la santé de première ligne. Il s'agit notamment de donner la priorité aux tests PCR financés par les deniers publics pour les personnes à risque élevé qui présentent des symptômes ou qui sont à risque de complications graves dues à la COVID-19, notamment pour confirmer un diagnostic de COVID-19 afin d'amorcer un traitement, ainsi que pour les travailleurs et les résidents des milieux les plus à risque, ainsi que pour les populations vulnérables. Étant donné la rapidité avec laquelle le Omicron s'est propagé, nous devons préserver ces ressources limitées pour ceux qui en ont le plus besoin, afin que ces tests soient utiles à la prise de décision clinique et la prise de décision en matière de santé publique. L'approvisionnement de l'Ontario en matière de tests antigéniques rapides reste limité à l'heure actuelle, étant donné que la demande internationale est forte. Et donc, nous accordons la priorité d'accès à ces tests aux milieux de la santé et les milieux les plus à risque. Toutefois, nous prévoyons un approvisionnement supplémentaire au cours des semaines à venir afin de fournir des tests à d'autres milieux prioritaires. De sorte que si vous avez des symptômes de COVID-19, que vous n'êtes pas admissible à un test PCR et que vous n'avez pas accès à un test antigénique rapide, vous devez présumer, étant donné la prévalence élevée dans la communauté, que vous êtes atteint de COVID-19. Vous devez donc rester à la maison, vous isoler conformément à nos nouvelles directives. Pour rappel, la période d'isolement est désormais de 5 jours pour les personnes entièrement vaccinées qui ont des symptômes. Cela s'applique également à leurs contacts familiaux. Après 5 jours, si vos symptômes ont disparu, vous pouvez mettre fin à votre période d'isolement, mais vous devez continuer de porter un masque bien ajusté à l'extérieur de votre domicile et ne pas rendre visite à une personne immunodéprimée, ni vous rendre dans un établissement de soins de longue durée, une résidence pour personnes âgées ou un hôpital pendant une période d'au moins 10 jours depuis l'apparition de vos symptômes. Si vous avez été exposé à une personne qui a obtenu un test positif à la COVID-19 et que vous êtes entièrement vacciné, que vous n'avez aucun symptôme et que vous n'êtes pas un contact proche de cette personne, vous devez
unvaccinated or partially vaccinated, you must isolate for 10 days along with your household contacts. Please visit ontario.ca/exposed if you think or know you have been exposed to COVID-19 to access information on what you can do to protect yourself and your contacts. While most Ontarians will not receive a phone call from public health with guidance on how to isolate, I want to encourage people to keep their eyes open for texts from the public health virtual assistant. These texts are not spam. Please take the time to fill in the required information, and it will provide advice to you on your self-isolation or monitoring period. I want to thank you all for your continued sacrifices, your tremendous resilience, and continued commitment to protecting one another from one wave to the next of this virus. This will be a tough January, but I am hopeful for a better February and a brighter outlook moving into March. Spring will bring relief, but for now, we must continue to dig deep and protect one another. Until then, until the spring, we are committed to using every possible resource available to protect Ontario through this difficult winter. Thank you, and I'm available to take questions.
Go to the phone lines for questions. Just a reminder, one question, one follow-up. Over to the first question, please.
From Holly Mackenzie-Souter at the Canadian Press. Please go ahead.
Hi. In the rapid test update that we just got with officials, they confirmed that if somebody's able to take 2 tests 24 to 48 hours apart and then their symptoms improve for 24 hours, they don't have to isolate for the full 5-day period. And I'm just wondering how to address the kind of inequity created by that, because some people can afford to buy the tests or have access while others don't, and wouldn't be able to go back to work, school, daycare, anything like that as soon as others. So if you could just comment on that.
Well, first, in general, there's a global supply issue associated with rapid antigen tests, and we are doing our utmost to provide more tests for Ontarians to be able to use them to guide decision-making. But given the high level of community activity of Omicron across all communities in Ontario, if you have symptoms, so fever and or cough or loss of taste or smell, and or the minor symptoms of nasal congestion, headache, muscle aches, joint aches, or fatigue or weakness, that is enough at present to define that you have COVID-19. There are very few other viruses circulating, certainly very little influenza and or rhinovirus activity at present. So if you have symptoms compatible with COVID-19, please, you don't necessarily need a test to confirm them. Monitor your symptoms. Once they improve and it's after 5 days and you're significantly better, you can return to work. For healthcare workers in particular, we'd advise you to get a RAT test for day 6 and day 7, just because healthcare workers are working with vulnerable populations, cancer patients, transplant patients, or in the long-term care setting, and we have to provide the best level of protection in those settings. But after 5 days of symptoms alone, you are less infectious and able to return to a normal workplace where you're not working with vulnerable patients or clients. Once we have RATs, they will be able to confirm if you have COVID-19, and one positive RAT test would confirm. You don't need anything else. You do not need a PCR test to confirm that you've got the illness, and you should follow the instructions of the 5 days of isolation, 10 if you're unvaccinated or immunocompromised. Once we have access, you're right, but there aren't many other viruses circulating right now. But 2 negatives 24 hours apart would allow you to return to your work environment or your school setting. Our goal is to have these tests as soon as possible for the school setting, where they would be used for symptoms. And if it's a positive, as we've said, you should stay home. If it's 2 negatives 24 hours apart and your symptoms are resolved, you can return to the school setting. We're doing our best to increase the availability, but at present, symptom monitoring, given the high community level of activity of Omicron, is a very good equivalent.
Follow-up?
Okay, thank you. Yeah, that didn't really address the inequity question that exists now, because some people do have rapid test access and therefore would have a shorter isolation. But I do have another question about testing for kids younger than 5, just because we know this group is the only group of people that can't be vaccinated. They're still going to group settings in daycare, and they aren't eligible for a PCR test. I'm just wondering the rationale for that and whether it might change.
Absolutely. If we get increased availability, we will try to bring back our AT testing to that environment. The work we're doing in that environment in particular now is to provide an option for N95 non-fitted masks to that workforce. Certainly, we're trying to accelerate first, second, or third doses to that workforce as well, so that the children are protected by not having vulnerable people to the virus working around them, and to continue all of the best precautions, the layered approaches for masking, hand hygiene, screening on a daily basis, for all of the symptoms of COVID-19. If you screen positive, please stay home for the full 5 days, or until if it's more than 5 days till your symptoms have improved significantly. All of those measures that we put in play, plus the recommendations on improving ventilation, should work to continue to make those childcare settings as safe as we can make them. And we are actively working to get as many RATs. You may have heard from the federal government that they've procured additional tests for us, and we're waiting the delivery of those. Our framework, though, everyone in Ontario should realize, is first use those RATs to keep our vulnerable settings safe, so our long-term care settings, retirement homes, hospital sectors, and other congregate settings. And once we can maintain that safe supply to ensure that patients are protected in those settings, we will move down our framework and provide them to be more accessible and available. And I'm sorry the global supply is so limited, but your government is working diligently to provide increased availability of these tests.
Next question.
From Stella Dupuis at Radio-Canada.
Yes, hello. So I was just wondering, Dr. Moore, if you could comment in French about what you were saying about the administration of third doses in the education sector.
With your permission, Stella, I continue to take my French lessons, and I don't think I'm fluent enough at present. But our third dose strategy for workers is to try to ensure that we can increase the access for all childcare workers, all staff in education settings to be able to have access for their third doses. We're working with school boards with third parties that can provide the immunization support. We know our health system partners, our hospitals, our public health units are fully active trying to immunize the general population following our guidelines. So we're trying to provide this additional resource to increase access for staff in those settings to get their third dose. We're aiming to have them up and running, as you've heard from the education announcement, as soon as possible to provide the level of protection as we further open our school settings. So it's all aspects of the health system are working diligently to try to protect the staff in those environments.
Follow-up? Yes, I had another question about rapid tests. I was wondering, what would you say to someone who looks, for example, who's trying to find some rapid tests and sees that there will no longer be some pop-up clinics on January 14? What do you say to them, to people who want to procure some and are worried about that?
First, I'd say, if I come down with the symptoms of COVID-19, so I get a fever and a cough, I'm not going to seek any confirmatory testing. I'm going to stay at home for the 5 days and hopefully my symptoms are resolved. I have had the benefit of receiving my vaccines and I will not seek any additional testing. Right now, given the high community prevalence of COVID-19, testing is a luxury. Monitoring your symptoms is what every Ontarian should be doing. If you've got a fever and or cough and or the minor symptoms of nasal congestion, headache, fatigue, muscle aches and joint aches, that alone has a high probability of being COVID at present, given over 600 per 100,000 is our current level of activity. It's never been so high. It's never been so prevalent in Ontario. If we have the luxury of testing, absolutely, when they're more available, we'll provide them first to those priority settings, like we've said. If you'd like to have your symptoms confirmed by a test, the availability of them will be improved in the coming weeks. But really, symptom monitoring is what every Ontarian should be doing. If you develop the symptoms, stay at home. We've done this prior for many other viruses, including influenza season. You stay at home when you're sick, and that decreases the transmission. And we've hitherto not had the benefit of testing. The access and availability of testing will improve, but common sense should prevail for every Ontarian who develops the symptoms of COVID-19. Consider those symptoms to be almost diagnostic at present, given how prevalent it is in our community. If your symptoms deteriorate and you get more short of breath or you get discomfort in your chest, absolutely you should seek health care. You should call your healthcare provider, seek guidance on whether you need further assessment, or if there are severe symptoms, absolutely would have to visit a local emergency department for those severe symptoms and get assessed. But for the vast majority of Ontarians, we'll be able to stay at home, to take Tylenol or ibuprofen or fluids to help us get over our symptoms, and we'll be better. The vast majority will be better. We are so fortunate that with Omicron, the severity of this illness is less. The risk of hospitalization is less. This is the first variant that's come forward that has less impact potentially on the hospital and healthcare system and severity at an individual level. The only problem for our province is it's so transmissible. So many of us are going to get it at a very simultaneous period that we've had to prepare the health system for additional bed capacity if necessary.
Next question.
From Rob Ferguson at the Toronto Star. Please go ahead.
Hi, Doctor. With all the concern being raised about capacity in the healthcare system, what are your thoughts on whether hospitals should be taking back unvaccinated workers who were terminated or otherwise suspended, whatever?
Our policy at the government level was to ask every healthcare institution to have an immunization policy that would have Please provide us with your immunization status, and or if you haven't been immunized, get educated. If you choose further not, despite education, to be immunized, you should have a testing strategy. So many hospitals have embraced that immunization policy and continue to test unimmunized workers and have them in the workplace. Those that, and it's not the majority, that adopted mandatory immunization policies have had great success with that strategy, in that the vast majority of their workers, 99% in many instances of healthcare professionals in particular, did go forward and get immunized. So they're not having a significant burden on their workforce. So I do believe the immunization policy that the government had recommended is working for Ontarians. We do have the testing strategy, and for those individuals that did not get vaccinated, they're at present, in the face of Omicron, will be getting tested on a daily basis. That's true where we asked the immunization policies in other settings outside of healthcare, so in other high-risk congregate settings. The immunize or test strategy still exists.
Follow up?
Okay, thank you, Doctor. And I'm wondering what you think people need to do more now. I mean, I think there's a lot of regret in the province that maybe some steps weren't taken earlier than Monday. What do you think people should be looking to as the next steps in getting Omicron under better control?
Well, thank you, Robert. Just to remind Ontarians, you've made sacrifices all along. So on December 17th, I believe, we asked that facilities move to 50% capacity. And we're very reluctant to impose any public health measures unless they're necessary. We also started our third dose strategy on December 12th to further protect Ontarians in a very robust and aggressive manner. Some days prior to the holidays, we were having 230,000 people immunized with their third dose. So Ontarians have come forward, number one, to get boosted, as well as have made the sacrifices that we've asked, decreased capacity limits before Christmas. Then we stopped the large mass gathering venues where we thought there could be ongoing transmission. And now, in a timely, phased, and reluctantly, have had to impose these much more aggressive public health measures. Our commitment to Ontarians is that we will only impose these for a time-limited period that will maximize the protection of the health system, that will continue to ensure that all Ontarians can receive care at the right place at the right time. Also, with a directive that I've written, we are, and again, regrettably, stopping elective surgeries for a defined period of time. That should give us 1,200 to 1,500 additional beds in which we can care for Ontarians if they need extra oxygen for a short period of time. We're also seeing some good trends in that. When we monitor ICU data, certainly the number of people in the intensive care unit has gone up, but their length of stay is shortened. So we're seeing it go from 13 days in early December right now down to 6 days. That, to me, is a very good trend, that even though our numbers are going up, we're going to be able to provide care in the intensive care setting if it's needed. It will be a very difficult January. We will reflect on whether we timed our decisions appropriately, given a very new threat in this province of Omicron. I take full responsibility for advising government on these decisions. I hope we've done the right decision making. I absolutely am reluctant to take away the freedoms of businesses and individuals and to keep our schools closed. These are very difficult decisions to make. And I hope Ontarians will, as usual, do their best in this very difficult time to limit the spread of this virus, to come forward to get their third doses. This is crucial that we increase our numbers. I am in no way happy at 180,000 doses a day. I would love us to, as the threat increases in the coming days, to get more and more individuals protected with the vaccine. And I trust all Ontarians will continue, as we've done before, to adhere to all the best practices of masking, of hand hygiene and distancing. I know this is a tremendous sacrifice we've made or asked Ontarians to make in the coming weeks. And I hope they'll understand it's so that as a community, we can face the common enemy of this virus, and we can together protect each other in the coming days by all of us adhering to these best practices. I hope and indeed pray that we will be able to provide care to all Ontarians if and when they need it. So thank you for that, Rob.
Next question.
From Colin DeMello at CTV News. Please go ahead.
Hi, good afternoon, Dr. Moore. I just wanted to ask about the recent death of a child under 10. All we know is that a COVID-19 positive girl under 10 years old died in Wellington County. Are you able to give us any more information on this? And what is being done differently in Ontario to treat young children with the disease?
Oh, Colin, I'm taken aback. I'm so sorry. I wasn't aware of this death in that area of the province. My heart goes out to the family and to the friends, and I hope we'll give the family the privacy to grieve and to try as best they can recover from the loss of their child. I'm very saddened to hear it. As far as your question, the death of children is exceptionally rare from this virus. So I am very saddened to hear it. These deaths in general, and I don't want to give any specifics, would be fully investigated by the attending physicians. They often are coroner cases, even though it's a natural death from a known virus. We want to learn as a system of if there was any failings in the healthcare system to provide care. Otherwise, I want to assure all Ontarians that we have some of the world's best pediatricians, infectious disease experts to be able to provide care to children, that we've only got a handful of children in intensive care units across Ontario at present. We're monitoring their capacity. They have only 70% of the beds in intensive care unit today for children are being used, and we're not seeing a significant rise in admissions. But we will, Colin, you'll have our assurance that we will learn from any death of any child to try to ensure it wasn't a failing of the health system, the failure to be able to provide care, that the child was provided as much care as was possible at the time, and share lessons learned back. Typically, the coroner system shares it back directly with the family. But to conclude, my sincere condolences to the family on their loss.
I appreciate that. Thank you, Dr. Moore. On another topic, you just said that testing in Ontario is a luxury, obviously because of the low availability of tests and the high demand. But isn't isolating also a luxury that certain segments of the working population can't really afford? Is there a strategy being developed at all for those part-time workers who would find it very difficult to isolate for 5 days at a time every time they come down with symptoms? Is there some kind of a strategy to maybe prioritize those frontline part-time workers so that they could also get either PCR tests or rapid tests to ensure that they could get back to work so that they could, put food on the table?
Well, I hope, a really good question, Colin, and thank you for it. I hope no one thinks I was being trite by saying access to a test is a luxury. We are trying to provide increased access and availability of testing in all provinces in Canada. We are one of the highest providers of RAT testing at an individual level, and we'll try, given the global supply chain, to be back able to provide RAT testing. My main point was if you have symptoms of COVID-19 at present, you don't need an absolute confirmation through tests, given the high community prevalence. If you have a fever and a cough and or loss of taste or smell, or those minor symptoms that I've previously mentioned, that correlates so strongly with a high probability of you having COVID that you don't necessarily need confirmation. If you're vulnerable, you've got underlying medical conditions, we absolutely want you to get assessed, and we've created that list of priorities for access to PCR testing in emergency departments, in hospitals, in long-term care, or patients with comorbidities. Those are our priority populations to get confirmation testing. because that can guide our treatment. It can guide the isolation within a hospital and ensure that others are protected around you. The other aspect is we have shortened the isolation period from 10 days to 5 days following best science if you're 2-dose vaccinated and you are not immunocompromised. That was to decrease the burden of isolation and ensure that if someone could isolate, it would have the least impact on their livelihoods. And I do think 5 days is very reasonable to be able to best protect others around you. That 5 days of isolation is then followed by 5 days of masking in public, and your avoidance of immunocompromised and not going to a long-term care facility or not visiting your grandparents who may be predisposed to this virus, given that your risk of viral shedding decreases day after day, day 6, 7, 8, 9, 10. And I think that will work well in Ontario because as a community in Ontario, all of us in public spaces and in businesses should be masking and providing a good hand hygiene, distancing, and be monitoring and trying to improve the ventilation in any of those environments. So I think this can work well. I think it's 5 days is realistic for 2-dose vaccinated individuals and can minimize the impact of the virus on their livelihood. Certainly when we have increased access to our ATs, that could give greater confidence that they're providing isolation for the appropriate reasons.
Last question.
From Carly Weeks at the Globe and Mail. Please go ahead.
Hi, Dr. Moore. Thanks for taking my question. I wanted to ask, you had mentioned in a previous briefing that a more formal or final decision on vaccines for children born in 2017 would be coming. Just wanted to know if any decision has been reached.
Oh, thank you, Carly. They are vigorously debating it at the Ontario Immunization Advisory Committee, and they haven't reached a conclusion. So as of today, it's still by date of birth that you'd be eligible for vaccination, turning 5. Today, you'd be eligible for your vaccination. And I'm sorry, the booking system is getting fixed to ensure that we have you can't book if you're 4 and haven't turned 5. So that would be fixed in the coming days. But just so individuals won't go to an immunization clinic expecting to be immunized, if you're not 5, they, for the most part, unless there's an off-label decision by a healthcare provider, will not receive the vaccine.
Follow up, and this is the last question.
Great, yeah. So you had mentioned that there is a plan in place to return to school January 17th. There's a number of things that you mentioned have been done, like more filters and N95s for staff, things like that. Is it realistic, though, to expect children will be back in class given the explosion in case numbers? Anything more you can share? Is that a realistic timeline at this point?
Well, the opening of schools certainly is a decision of government. I think we all understand that there's negatives and positives to keeping our schools closed. And I, like all of my colleagues in public health, hope that we can have our children back for in-person learning as soon as possible. So in the interim, despite that aspirational goal, and with that aspirational goal, we are further immunizing first, second, and third doses for the staff of childcare and in education. We are further providing first and second doses to children 5 to 11. We're further purchasing additional N95 and high-grade masks for children. We're 3,000 additional HEPA filters have been purchased, and we're interested in putting those in play as soon as possible. And we're reviewing all of our guidelines to ensure we're keeping up to the standard on protecting our schools, as well as reviewing all environmental health, cleaning, and ventilation standards. So that work's getting done. We're working in the background. I think all students want to be back in class. All parents would love them in class. And we're working with the education sector to ensure our schools remain as safe as possible. That is our goal. But the eventual decision of this is the decision of government. And it's certainly our hope that we can adhere to the 17th.
Thanks, everyone.